Jonathan Ashworth.
56,308 excess deaths since the beginning of March, 12,500 of which are not related to COVID. But we do have one of the worst excess death rates in the world. Why does the Secretary of State think that is?
I entirely agree with him that it is critical that people play their part in making sure that we continue the work of controlling this virus and driving down the number of new transmissions. I'm glad that he recognises the work that's been done, which is not really just the work of government, it's the work of all of us to get this virus under control.
But what action will be taken to minimise risk for Black, Asian and minority ethnic people?
To answer his question specifically, he asks about the inequalities in health outcomes. He's quite right to address this subject. It's a subject that was important before we went into the coronavirus crisis, and it is even more important now. Black lives matter, and as do those of the poorest areas of our country, which have worse health outcomes, and we need to make sure that all of these considerations are taken into account and action is taken to level up the health outcomes of people across this country, because there is no more important levelling up than the levelling up of your life expectancy and the quality of health with which you live that life.
He will have seen today, I'm sure, the CQC report that shows a 134% increase in deaths of people with learning disabilities. Surely it is now time to expand testing to those under 65 in receipt of adult social care.
He asked specifically about those with learning disabilities and autism. That testing in care homes for those of working age has continued all the way through this crisis, and we're rolling it out further.
Particularly those in the shielding group. They really shouldn't have had to wake up on Sunday morning to find out that they could now leave the house once a day. They need clarity in details. And why weren't GPs informed in advance?
He mentions the changes to those who are in the shielding category. I was very pleased we were able to make these changes. We announced them at the weekend, and they've been very well received, especially by those who are shielding, because they're now able safely to go outside, which it's hard to underestimate, Mr. Speaker, the impact of saying to people that for 10 weeks the recommendation, medical advice, was that they shouldn't go outside. And I'm very glad we've been able to lift just slightly the restrictions on those in the shielding category.
Will he now publish the total number of planned operations that have been cancelled and detail them by procedure? Is it his intention to step down some of that surge capacity so this backlogging clinical need can start to be tackled?
He asks also about the restart of the NHS. It is vital that we get the rest of the NHS going again. That work is underway. The expansion of cancer facilities is underway. The demand for A&E and urgent care is not as high as it was, but I look forward to the full restoration, Mr. Speaker, of our A&E facilities across the country and also in central Lancashire.
Will he start publishing again the actual numbers of people tested? Will he stop counting tests mailed to homes as completed? Can he detail what proportion of the 200,000 tests are diagnostic PCR tests, what proportion are antibody, what proportion are surveillance? Can he tell us how many care home staff and residents have been tested, and when will he start weekly testing of all NHS staff? Can he tell us what percentage of the Deloitte-run testing facilities have been sent to GPs?
We absolutely will publish data on that, but as the letter from the Chief Statistician from UKSA shows this morning, it is very important that we get that data publication right, and so we will work with the UK Statistics Authority to make sure that they are happy with how we're publishing that data, to make sure that we get the data published in a reasonable and sensible way, in a way that also supports the operation of NHS Test and Trace, which we agree is an absolutely critical part of the next stage. So I commit to publishing that data and to working with the UKSA on how that data is put together.
Can he confirm that local directors of public health have been told to prepare strategies for tracing with a deadline of the end of June? That they won't actually start receiving local individual data until next week, and many still haven't been told their allocations of the extra 300 million, nor what they can spend it on. And will he publish the data on what percentage of infections have been contacted and how many contacts have been followed up?
He asked rightly about the NHS test and trace capability. That is up and running and working well. He asked how I can say it's working well. It's working well because thousands of people have been contacted and are being traced. Their contacts are being traced, and so the system is working.